Today I am going to tell you about in brief about the dengue fever. In our recent past, we have seen an epidemic of dengue in our Telangana state, and we have witnessed that more than 50 to 60 patients are getting admitted in a month with a dengue fever. What is dengue fever? Then the public is having a lot of myths, and in fact they know about the myths about the dengue fever. They are having a lot of confusion about the dengue fever. First, I am going to tell you what is dengue fever. It is a mosquito-borne disease which gets transmitted through the bite of female Aedes aegypti mosquito. The second question which comes to our mind is how does it spread in the community so fast? Again, because it is a mosquito borne, once the mosquito bites to a non-infected person or infected person, when the mosquito bites to an infected person, it takes that infected blood, suck the infected blood, again when it goes and bites to another non-infected person, it transmits the virus to the another person. This is how it spreads. Now what are the different types of dengue infections which we come across is, there are 4 types: dengue type 1, type 2, type 3 and type 4 viruses. These are the different serotypes. And what are the symptoms for that? Suppose if anyone gets infected with a dengue, what are they going to experience? They have a very high grade fever, usually fever touching 103 and 104, with a severe myalgias, body aches, and the patient also have a typical eye pain. It is also called as retroorbital pain, and many of the patients they also experienced, when it becomes complicated, abdominal pain and vomitings. So friends, what are you going to do? Suppose if you are seeing anyone who is suffering from this type of illness, don't get panic. See, every infection or every fever is not a dengue fever. It could turn out to be some other fevers also, because now there is a rampant of dengue in our city, Hyderabad. Many people are very concerned about that. So in short, when you see anyone suffering from fever and severe body aches and severe eye pain, and they are not having any other symptoms like in the form of sore throat or in loose motions or any vomiting, it could be a viral infection. The same symptoms can also accompany the bacterial infections. So what are you going to do now? So there are 3 or 4 types of clinical presentations. One is a dengue fever, where what I told about the signs and symptoms, that will be over. And this virus is most of the viral infections are self-limiting, and this is also ends in 7 to 12 days. If you experience this, please be at home, take rest, take paracetamol for the fever, make sure that you are good hydrated, well hydrated. If you are having any vomitings, please admit into the hospital, take IV fluids. The only mainstay of the treatment, if you ask me, for the dengue is a supportive treatment, where the patient is having fever, give paracetamol, patient is having dehydration, give him IV fluids. If in case, if you proceed to the next step where the patient has a dengue shock syndrome or dengue hemorrhagic fever, then we have to see for the platelet count. One very important remark I want to make here is that the public is having a lot of confusion when to infuse the platelet. They are running behind the hospitals. See, if you see the WHO classification for the platelets infusion, there is no need to get panic unless the platelet goes below 20,000 or 50,000, and if the patient is having any clinical symptoms in the form of bruising or epistaxis or gum bleeding, then definitely there is a need for the platelet infusions. Otherwise, please don't get panic. Be at home, take paracetamol, get well hydrated, and if you feel any complications in the form of dehydration or any gum bleeding or any epistaxis, please report to the doctor immediately. Coming to the treatment part, as such, there is no particular any antibiotic or antiviral which has been given in this infection. So don't get loaded with antibiotics unnecessary in your body. It is causing a lot of problems. We already know that AMR, antimicrobial resistance, is a major problem across the country, even globally. So don't take unnecessary antibiotics. Consult a doctor immediately. Get your complete blood picture done, and if the doctor says, please repeat your platelet counts as he advised. Coming to the prevention part, which is the most important if you ask me, please prevent this infection. Spread the message. Don't spread the panic. Tell the people to use mosquito nets or a mosquito repellent. And please, if you have any case of dengue infection in and in your surroundings and in your area, please inform to DMHO office. They will come and they spread the insecticides They'll see if any stagnant water is there, they'll remove it. And make sure in your houses also, please clean the pots, especially the flower pots clean. Don't stagnate with the water. Clean your air coolers. If it is stagnant with the water, please throw it, and make sure that the surroundings around you is free of any stagnant water. And please use mosquito nets and cover your skin, like use full sleeves, especially for the kids. Please give them full sleeve cloths and cover their bodies completely. Stay healthy and stay happy. Don't get unnecessary panic. Thank you.